Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Unfortunately, many physicians often fall short when attempting to effectively treat chronic pain, and this resorts to the only treatment they know, prescription drugs. So while these drugs may bring some temporary relief, they'll do nothing to resolve the underlying causes of the pain. So if you suffer from chronic pain, making the following changes to your diet can really help. And they're better than resorting to a lot of prescription medications that have bad side effects and end up causing a lot of issues with ill health in other ways, in other parts of your body. So one thing you want to do is you want to consume more animal-based omega-3 fats. Similar to the effects of anti-inflammatory pharmaceutical drugs, omega-3 fats from fish oils, for example, work directly or indirectly to change certain cellular activities that cause inflammation. So while drugs have a powerful ability to inhibit your body's pain signals, omega-3s cause more of a gentle shift in cell signaling to bring about less of a reaction to pain. So eating healthy seafood like anchovies, sardines, despite what you may think of the taste, which are low in environmental toxins as well, like mercury and other heavy metals. We're taking high quality supplements like krill oil. These are your best options for getting the most bang for your buck in terms of omega-3s. DHA and EPA, the omega-3 oils that are contained in krill oil, have been found in many studies involving animals to have anti-inflammatory properties, and those are especially important for pain relief. Also, you should radically reduce your intake of processed foods. I can't overemphasize this more. Processed foods not only contain chemical additives and excessive amounts of sugar, but they're also loaded with damaging omega-6 fats. And by eating these foods, especially fried foods, those are really bad, you upset your body's ratio of omega-3 to omega-6 fatty acids, and this triggers inflammation. And that's a key factor in most pain. So you want to decrease the omega-6 fatty acids and increase the omega-3 fatty acids. Also, eliminate or radically reduce your consumption of grains and sugars is important in naturally decreasing your pain and inflammation with diet. Avoiding grains and sugars, especially fructose, which is the sugar in fruit, will lower your insulin and leptin levels, and elevated insulin and leptin levels are one of the most profound stimulators of inflammation and also inflammatory pathways in the body. And that definitely contributes to pain, so you want to limit those. And while people who are healthy are advised to keep their daily fructose consumption below 25 grams from all sources, you'll also want to limit your intake to 15 grams a day until your pain is reduced. And also, your uric acid levels are increased with sugar intake, and that can lead to chronic low-level inflammation. And if you recall, it's especially strong with gout, the uric acid levels, which is very extreme inflammation. Also, you want to optimize your production of vitamin D as much as possible. Regulate the vitamin D levels by regularly exposing yourself to sunlight. If you can't get sufficient sun, try taking an oral vitamin D3 supplement along with vitamin K2 and magnesium. Get your blood tested on a regular basis to make sure that you're within the therapeutic range of 60 to 80 nanograms per milliliter year-round for vitamin D. And of course, make sure you get your spine adjusted on a regular basis to reduce nerve interference and optimize the function of your body as a whole, because we do live our lives through our nervous system, so we want to make sure the nervous system works properly. Check us out at newhopechiropractic.com. Make an appointment if you haven't been in for a while. Get your spine checked, and your health will be much better. Your body will thank you for it. Have a healthy day.